Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Okay, you want to tell us about the celebration of life of Kevin?
Yeah, I wanted to add this. I didn't send this out to the email group. I just thought I'd share with us that attend on a regular, because we got to know Kevin pretty well. Yeah, so he passed away Wednesday before last, and he was in surgery. So the background story: he was on the transplant list to get a liver, because he had got diagnosed with liver cancer, but he had the chemo treatment, and the tumor had pretty much disappeared. So he was really happy about that part. But then they found a blood clot inside of the liver. So they took him off the transplant list. So he was very upset about that, very discouraged. But then they said, okay, we can do a surgery and try to remove the blood clot. While he was in surgery for the removal of the blood clot, he coded and passed away. So very sad. He's got these 3 beautiful grandkids on there. He's got a son and a daughter. And the service is up in Annapolis on the 15th. It's on Sunday. So I'll be going to that.
Right.
Wow.
Next year. Yeah, we will miss him very much.
Yes.
John, he was a musician too, wasn't he?
No,
He wasn't.
No, he was just a longtime friend.
Okay.
Yeah.
So sad. Seems like he was just with us. Sad.
Yeah, he got me to start golfing now. He was an avid golfer. he wasn't very good, but he got me involved. And so I was taking golf lessons with him from a golf instructor. And so we got to go out and try to do that. So, okay.
John, I'd like to send some flowers down to, is that a church?
No, but click on that link and it'll take you right to the I think it's a Facebook page, and they really don't want any donations or flowers or anything. But
okay.
yeah, click on that while it's on.
Do they have somewhere where you could donate something?
I was saying they didn't want any donations,
Oh,
But
okay.
yeah, if you go to the Facebook page, which that's the link there, you can copy that. I'll put it in the chat eventually.
Okay.
All right.
He was a friend of a musician friend of mine.
Oh, okay. Yes. Oh, all
And
right.
he and last week after we talked, I looked and he had posted this same picture talking about Kevin.
What was it? Ed Crowley?
No, it was Tam Sullivan.
Oh, I know Tam.
Yeah, they have the same last name, but they're not related.
Yeah, I used to play with Tam.
Yeah.
Yeah, no Tam. About the same amount of time. Okay.
Thank you.
Thank you. All right, Doc.
Yeah, go ahead. This is an interesting article on as physicians and healthcare providers, how do you prescribe exercise since it's not treatment, but it's prevention? And what is interesting is that we probably should spend more time with preventive aspects of health than we do with treatment, because then that would prevent some of the problems from occurring in the first place. And so this talks about the types of exercise that you should prescribe. And most doctors don't suggest high intensity regimens because if they don't have, if they have cardiovascular disease, that could take them beyond their limits. So that most of the exercise are light physical activities. And they just talk about some of the warning signs if you have cardiovascular disease and you have dizziness. Orthopnea is shortness of breath when you lie down. For example, if you have to have pillows to breathe when you lie down, that's called orthopnea. If your heart rate goes over 100, although it's desirable for your heart rate to be about 120, but it's not desirable for you to have a regular heart rhythm. So it's the rhythm that is really a problem as well. Of course, the rate is over 140, then that's a concern. When you get edema in the lower extremities, you think of either varicose veins or heart or kidney disease or liver disease. Chest pain, when it occurs with exercise, is a warning that your coronary arteries are stressed and you need to be examined to see if you have a coronary artery disease. Intermittent claudication, that's a form of pain in your calves when you walk. And that is a sign of poor circulation. This means you should see the doctor about it. And if you have heart murmurs or shortness of breath, and if you get fatigued early, these are some of the reasons why you may not want to recommend high intensity exercises, but and the exercise that most people recommend are that 30 minutes a day, 5 days a week, 150 minutes a week is the aerobic exercises that are not high intensity, and those are the prescriptions that we as physicians and healthcare providers should recommend for all patients. But there's a lack of consistency with which doctors recommend aerobic exercise, strength training, as well as proper nutrition. Some would argue that proper nutrition is not stressed in medical school, but it should be, although we do have courses on nutrition in medical school.
Dr. Callender, what is it? Edema? I think I know what it is.
Swelling, that's where you have swelling. Fluid accumulates in the tissues.
And dyspnea?
Shortness of breath. Dyspnea is shortness of breath, where you have trouble breathing and you have to get oxygen. Any other of those terms that I didn't identify for you?
You said orthopnea.
Yeah, that's where you have to have a pillow in order for you to breathe while you're sleeping. Some people require one pillow, some two pillows, some three pillows. That suggests you have cardiovascular heart disease. But it is clear that exercise is important, and quality, long life with quality is difficult to achieve without proper nutrition and exercise.
Did you define intermittent claudication?
Intermittent claudication is where you have pain in your calves when you walk, and when you stop walking, it goes away. That's intermittent claudication, and that's a sign that you have poor circulation to the legs, and so you need to get your blood vessels in your legs checked to make sure that so that it can be corrected. Some people have one block claudication, some 2 blocks, and yeah. So, but it's a sign of peripheral vascular disease. Now, I remember we had another Kevin who was on waiting for a transplant, subsequently got his transplant, but I think his father died during exercise. So there's some exercises that are high intensity that perhaps you shouldn't be involved without getting a doctor's exam. Of course, as you know, people die in marathons all the time. So so that doesn't mean you should not do marathons. It just means you should be evaluated prior to that. Any comments or questions about that? Not, okay, we'll go to the next one. This is an article that talks about the fact that depression can be a risk factor for type 2 diabetes, and that there's a direct correlation. Whether they're cause and effect is another question, but the fact that many people with depression have type 2 diabetes and vice versa, it's an association that may or not be related, but the fact that the two come together is of interest. Any other thoughts about that? It's kind of a new association of the two, without causality being involved. Just know that the two go together.
Dr. Callender, what about type 1 diabetes?
Type 1 is genetic, and is what happens is that you actually have the pancreas does not produce insulin, and so they're two completely different diseases. And that type 1 is associated with no insulin production, and type 2 is associated with insulin production, but the body is resistant to the insulin that is produced. And so it is thought that obesity and some other things are responsible for the insulin resistance that occurs with type 2 diabetes. It's often managed by weight reduction and exercise and proper nutrition. Yeah.
Good morning, everybody. Listening to you talk about these two things working together, or being diagnosed as maybe being part of diabetes or having something to do with diabetes. I noticed here lately when my husband has checkups and stuff, they're always asking him about depression. And I'm wondering if that's maybe where they're getting some of the reasons why if people say yes when they're asked, because he does have type 2 diabetes, and they're almost always they're asking him some questions about depression.
Yeah, there is that association, but so far we found no way to link the two together in terms of one thing causing the other.
Yeah,
So
yeah,
there just appears to be an association.
yeah. What's the name of your sleep medicine? Trizone. Trizone. He takes Trizone for sleep, but they always question him. You taking that because of depression? And so I'm wondering.
Yeah,
Yeah,
it's something
there was
oh,
there
Darryl.
was a there was a comment earlier in the article that was talking about insulin triggering inflammation in the triggering inflammation in the brain, and so I don't know if you would classify diabetes as an inflammatory type of illness, but I do know that stress and negative emotions can increase inflammation throughout the body, including the brain. And so maybe that's the link between depression and diabetes.
So far, while the link exists, we don't know whether there's causation, but your comments about inflammation are accurate.
Dr. Callender,
Go ahead.
when I go to the doctor, any kind of doctor here in the last, I think at least in the last 3 years, going back to before the pandemic, they ask you about depression. Do you have suicidal thoughts? Have you ever thought about killing yourself and those types of things? But I wanted to know, I got depressed many years ago after I had a traumatic incident, and I was treated for it at that time. But I wanted to know, could you be depressed and not know you're depressed? I know that if it says things about if you're, stop doing your regular activities and if you don't have, your feelings. But I'm just wondering, could you have depression and not know you have depression?
I'm not familiar with that situation. Anybody? Uh, because depression actually is something that you would usually be aware of. Uh, so I don't know that you would have depression and not be aware of it.
Okay.
Anybody know of any experiences where you have depression and you have no idea that you're depressed? I'm not familiar with that entity.
Dr. Callender, I always wondered about that because when my doctor does my complete physical once a year, whatever that is, and one of the questions is, are you depressed? And I'm thinking to myself, no, and if I was, I wouldn't tell you. But I was just thinking, who tells people that they're depressed who are really depressed?
Well, they can tell you by their actions, and
But
they
in the
usually
doctor's office,
they,
just 5
and
minutes.
they usually know that they're depressed too.
Oh,
There
okay.
is there is a social stigma about admitting to depression, and some people are in denial about depression. Uh, sometimes you can observe somebody and you'll make a comment, "Hey, you act like you're depressed," and it's kind of obvious that they are, but they may be in denial about depression.
Uh-huh.
And Carol, that's become a part of my regular physicals. I had one last month, and that question came out this year, last year. Is it as a result of COVID? Is it because of age? But yeah, it seems to be a follow up to the physical. Are you depressed? You
Uh-huh.
think about it. I don't think so, but maybe at one time. But and like you said, I'm not going to say I don't admit to it, but I don't think I am. So I don't know if that's a part of normal physical exams, Dr. Callender. Is that something that they ask at a certain age?
Well, anxiety, you may recall we've had a number of articles on the fact that anxiety is so common now And one of the ways in which anxiety manifests itself is depression. But anxiety, and many of the articles now recommend as part of all physicals, is that you look for anxiety and depression, especially in people over 65. Elizabeth, you had a question, comment?
Yes, one comment. As an educator, I was always concerned about the holistic child. Okay, and one of the things I incorporated was with every subject I taught as a sixth grade teacher, I had art related. I incorporated PE and art. Okay, the constant movement, because I didn't want them sitting a lot. And one of the things that I noticed that throughout my 20 plus years is that when I incorporated art, I had one particular student I'll never forget. He started off coloring with a lot of dark colors. Everything he had was very dark colors. And so I kept instilling, things to lighten their day and stuff, And by the end of the year, his artwork was very beautiful, very beautiful.
Okay, thank you.
Yeah, we have a lot of words that are all the same. They're all expressions of the same thing, just different levels. We can say anxiety, fear, anger, depression. And we think there's a difference in all of those words, but they're all just different levels of fear. There's an old definition that says depression is anger without the excitement.
Oh.
Okay.
I noticed that I can't remember how far back it went, but I've had Kaiser for a long time. They've included I don't know how far back though, questions about your feelings. How are you feeling? Do you feel depressed? Have you ever had suicidal thoughts or anything like that? So I think it's become pretty standard in health assessments, your mental state. And I think some people, if they're younger, they may not even realize what it is, what depression is, because it's kind of a foreign concept to most people, I think.
Okay, let's go to the next one. I think.
I just have one more question.
Okay.
Okay, a doctor tells you that you have depression and you need to see a psychiatrist. The first thing you want to think is, I'm not crazy. So, and how can you tell me I'm depressed? And I shouldn't have told you I'm depressed. I mean, the way our society is, how do doctors confront that? I mean, do doctors actually tell patients they need to see a therapist? I've heard of some that done it, and I've heard people's comments. My doctor told me that, but I'm not going to do that. I'm not crazy.
So what is your question, though?
My question is, how do doctors actually help people who are depressed?
We recommend that they get psychotherapy or be seen by a psychiatrist or a psychologist. And as you know, John Robinson, who was part of our group, talked about the merits of psychotherapy as well as medication. And many of the studies now indicate that psychotherapy may probably be the most effective way of treating people who have anxiety disorders, including depression. So recommending that they get mental health therapists is part of the prescription for their health. So that as was reported to us at one presentation, if you don't have mental health, then you don't have health. And so it's an important part of your health for you to be mentally healthy. And so our responsibility is to refer you to psychotherapist, a psychologist, or psychiatrist if you have mental illness as well, because it's just another type of illness. So you're not healthy if you're mentally ill. So we have a responsibility, therefore, to refer you to somebody to help you get mentally well.
Okay, well, Dr. Callender, one more fact. You do know how that sounds to the layman to say that I'm depressed and I need to see a psychiatrist because I'm depressed. My thought is, I'm not going to spend that extra money. I'll get over my depression or I'll work through it. I don't need to spend money to go see another one person because the way our culture is, and you don't dare tell anybody, but
Why not?
huh?
Why not?
Because our culture says if you go to a psychiatrist, you are really in bad shape.
No, that's past history.
Yeah.
That's not current.
I think it's still history. I think it's still present today.
Well, it shouldn't be, and it's time we got away from that stigma because it's killing people. So we need to talk about our physical health as well as our mental health. And we need to be able to accept the fact that it's okay to see a psychiatrist, okay to see a psychotherapist, because it's part of your ability to stay healthy. And if you're not, if you don't have good mental health, you don't have good health.
Dr. Callender,
That's the education we have to teach our people our age and people younger than us. That you're not healthy if you're mentally ill. So you need to get that illness taken care of you, just as if you had diabetes or heart disease or anything else. And so that stigma that we had needs to be eliminated. And we need to work hard. We need to work hard to eliminate it.
How do we eliminate that?
Education. That's how we eliminate it, by education. And then trying to teach our children that it's okay to see a psychiatrist. It's okay to see a psychotherapist. It's okay to see a psychologist. And so it's just like I have to educate about organ donation. I still have to educate about mental illness. And that this is a disease that is killing us. Suicide, we talked about suicide somewhere in the world every 40 seconds. That's a serious mental health illness that needs to be addressed aggressively.
Dr. Callender, the word that I think everybody is trying to avoid is crazy. You know,
crazy these days is inappropriate. Mental illness is the proper term. You're right. People are avoiding crazy because crazy doesn't really tell you anything. It doesn't say what kind of mental illness you have. It's just a term that we use that was used in a derogatory fashion. And so we are trying now to use words that don't denote negative characteristics, and to say that you have a mental illness that can be treated is the positive way of approaching it, and is an approach that is necessary as we move towards good health, because good health requires you to have mental health.
Yeah.
Well, I'm not mentally ill. I just have some adjustment challenges.
And I think we all do, but I think that theory, going to talk to someone or a psychiatrist, it is a myth. Well, years ago, you would use the word that John used. Yeah, she crazy or he crazy. They're talking to a psychiatrist. But I know of too many people today who will go talk to someone and they feel relieved. Sometimes if you talk to an individual, and whether it's professional or not, but in this case, I'm speaking about a professional, you get relief. You tell that person things that you wouldn't tell someone else, or they might give you a response to feelings or questions that you can't receive from a friend or a loved one. I think going to a psychiatrist or a mental professionalist or someone in that category, I think it's helpful to a lot of people today. It's not quite like it used to be.
Yeah, I think a lot of people
Mhm.
need help with mental health. And I think that's a more polite way, to talk about it. Many of us have mental health issues. That doesn't make us crazy,
Right.
or and a psychologist or a psychotherapist can help a lot of people.
Especially, in our society when we have so many children who are associated with trauma. Trauma at an early age is a common cause of mental illness. And the sooner that can be treated, the better it is. Because in the long run, it may decrease the likelihood of illnesses. Darryl talked about inflammation. Inflammation manifests itself in many ways, and ill health is one of the manifestations of trauma and mental health that progresses without treatment.
Yeah, women are more likely to find somebody to talk to. Men just are more likely to bottle it up, not find anybody to talk to about negative feelings and emotions, and just become psychopaths.
Well, you crazy.
Mary Ellen, you had a comment? Oh, no. Okay. All right. So I've had a healthy discussion on depression and mental health and stigmas that abound, but need to be minimized or eradicated.
Mhm.
Well, this is something that finally the FDA and the CDC have approved the new coronavirus vaccine.
Mhm.
The question is who should receive them and when, and what do you do if you are overdue for the old booster and the new booster now is approved but is not available? What are your thoughts? What do you do, and what is the recommendation? And I think it's pretty clear that now we have 3 vaccines that you need to take.
Mhm.
And
Yep.
it also is true that the new vaccine makes the old vaccine outdated. And so from this point on, the new updated vaccine is what should be taken by anyone, and along with the RSV and the flu vaccine. So those are the 3 vaccines that one should take. And I guess the key phrase that you need to recognize is that certainly before November, you should have all 3 of those vaccines. Any comments or questions about we talked about this last week, but last week the vaccine was not available. This week it's probably not either, but it is now approved by FDA and the CDC.
So, Dr. Callender, we have 5 articles about this, but this article is from over a year ago, 22. I was wondering about that.
Well, I think it's interesting because the date does not. The booster is just came out, was just approved, and it's available. It probably has not been released yet.
Okay, but this
May be released any day or so, but if you went to the pharmacy today, you couldn't get it. Right.
But this article is from, like I said, a year ago.
Yeah, right.
Oh, so this is talking about the last booster.
Right, the concept is there, but we got several other articles. I'm gonna go ahead to the next one.
Yeah, okay.
That's my birthday.
Uh-huh.
Yeah, and that's what is new about this, is that they have they're designed to address the recent COVID variants. And this is why it is not recommended at this point that you no longer receive the bivalent vaccines, because they are not as up to date as these, and so that's why they're not called a booster. As a matter of fact, it's called updated vaccine. In contrast to the term booster, and that's what
Oh,
that Mr. Buchanan was talking about, the fact that it's not a booster. It's really, you could argue that it's not. It's still a booster, but it's one that is addressing the recent variants, so that the bivalents now are past history, and the updated updated vaccine is what is okay for those who are going to get the coronavirus vaccine. You want the new updated vaccine, not the booster
okay.
anymore, not the booster anymore. So keep that in mind. And so there's going to be a lot of confusion and misunderstandings about it. But recognize that the bivalent booster, as soon as that updated vaccine becomes available, will be outmoded and will be no longer provided. Now, what is interesting, if you go to the pharmacist today, you would get the bivalent vaccine, but that is no longer the vaccine that you should take. Now we have another issue also, which has to do with the finances, and that while we will have this updated vaccine, those who have no insurance will not be provided with the ability to take the vaccine until October, and so that poses a problem to those people who have no insurance. That's an issue that we haven't addressed yet. Well, we've addressed it, but it's going to occur in October, and that is a concern of those people who have no insurance. Any comments or questions about the new flu preparations for the winter season?
Doctor, could you get all 3 vaccines at the same time?
When they are available, yes. But remember, they have to be in different needles. Get 3 shots, but yes, you can when they're available.
Okay.
The RSV, some pharmacies still don't have RSV, and the flu shot most have, and the coronavirus they don't have yet. So it's a little early to be getting all 3 of them.
I have a question, Doc. So I got my second bivalent in May, I think it was last year. When the new
May of last year or May of this year?
Of this year, I'm sorry. And when this new vaccine comes out, is it too early to get it? Or do I have to wait 6 months?
No, you get it whenever it becomes available.
Okay.
Don't wait, because this is now different, and so as soon as it becomes available, you can take it.
Thanks.
I was reading, I heard you say we could get all 3 vaccines at the same time. But I read in the AARP magazine that it is okay to get the pneumonia and the COVID vaccine together. I mean, the flu and the COVID vaccine together. But the RSV, you should take it at a separate time.
Well, most of the recent data suggests that you can take all 3 at the same time, but you should never combine any of them. They should be separate
Yeah,
shots.
separate shots. Yeah. Okay.
All 3 of them should be separate shots.
Okay.
But if you want to separate them, that's okay. It wouldn't hurt. But the evidence suggests as long as you don't mix them, they can be given the same time. Now, of course, that's 3 different shots. So you may want to, you may not want to take all 3 at the same time. But
You have to get them in your arm.
no, you can get them anywhere you want them, you know, as long as they're given subcutaneously.
Okay.
Your butt is bigger, so you can get them in your butt too. But most people just get it in the shoulder. Is this frightening to get 3 shots at this similar time?
Yeah.
It's frightening to get one.
That's why I'm laughing. He said
Yeah.
it's frightening to get 3.
Especially
Frightening to get any of them.
especially in your butt.
No, I'd rather in my butt. I get 1 in each arm and then in my butt. That's enough.
I
Makes sense.
heard that you don't feel it in your stomach. Is that true?
I think you feel it less in your stomach. Still, it's an injection. But, you know, many people who are diabetics, that's where they take their shots because they think they have less pain.
Oh, and if you got a lot of fat around your stomach, that's less pain than that?
Yeah, that's right. Yeah.
Oh,
It's like
okay.
like your butt. Yeah. Except it's easy to get to.
Which one's easier to get to?
The
Your belly.
stomach.
The stomach. Oh, okay.
Yeah.
So if I just go and say, I want it in my stomach, they'll give it to me in my stomach.
Yeah. The
Could
difference
I
is
get my shingles in my stomach?
I don't know that it matters where you get it, whether you get it in your shoulder or your stomach.
Because that thing hurts.
Yeah, it does.
I heard of a friend got the flu shot and got really sick, had to go to the hospital after getting the flu shot.
That can occur with any shot. So you're right. There's some people who do get problems after getting vaccinated.
Could that be a reaction to the substrate? Because flu uses that sometimes a live culture or something in there.
I don't know why that your friend what they reacted to. I can't tell. I wouldn't know.
Dr. Callender, this is Sylvia. Is there any information on the testing of the new shot on individuals who actually have received all their shots, or is there any information where you can read the impact of the new COVID shot?
Probably not until it comes out. Right now, there isn't a lot of information on it. But after FDA approves it, which it has, and CDC has approved it, which it has, information should be forthcoming shortly.
Okay, thank you.
Any other comments or questions? Important topic because very timely, since it's it's important to get these vaccines done before November, because that's when most of the respiratory illnesses begin. Some people have already had RSV, but many people haven't. And we've never had a vaccine for RSV before, so this is brand new.
You know, Dr.
Dr.
Campbell,
Callender,
it seems like we're at war.
Well, we've been at war with the viruses, and for the most part, they have the vaccines have helped us win the battles.
Dr. Dr. Callender, I was in a RSV study and it ended at the 1st of August, but they didn't tell us which people got the vaccine and which didn't. So it wouldn't make a difference if I went on and had the vaccine again, would it?
Well, now, are they still not going to tell you if you ask?
I've asked a few times. I've called and asked, and they said that they don't have the information.
How recently have you called?
Last week,
Wow, that's amazing.
they said they were going to send a letter, but they never sent a letter.
Wow.
They just called me on the phone and told me that it was through. And to make sure that that was correct, I called them and they said, yes, that was true. I said, well, did I have the vaccine or did I have the placebo? And they said, you'll get a letter. And I waited 2 weeks. I didn't get a letter. And so I've been calling every week since the 1st
Makes
of
sense.
August.
Yeah, it makes
And
sense.
they haven't told me whether or not I had the vaccine or not.
Yeah, you need to know. You're right. Absolutely. That's one of the things about most of these studies. They do have a placebo arm, which means you didn't get the vaccine. And so you do need to know. So you know whether you need to get the RSV or not.
But would it hurt me if I got it?
I don't know the answer to that question because we've never had the RSV
Okay.
before. So this is the first
Well,
time.
if they don't give me an answer, is there somebody that I could go to that regulates people that do this kind of thing to make them to follow the correct protocol?
Well, I think they may be following the protocol, but I think now that it has been released, because you didn't have, although the RSV has been FDA approved, I'm not sure where it's available right now. And so you need to call them back again this week and let them know that you want to know, and if that person does not give you the answer, ask them to let you speak to somebody higher up in the organization so they can give you an answer, because you deserve the right you have the right to know.
Okay, thank you.
Any other questions about these times, because we're getting into the respiratory flu season, so, and the flu shots are available, but the other two, the timeliness is not quite clear. Because I was in the pharmacy the other day and a lady was asking for RSV and the pharmacy had not received it yet. So. Okay, let's go to the next one.
This article is about long COVID.
Yeah, this is an interesting one because long COVID means that these people have had COVID for some time, and how should they take the shot? And to me, it's clear that they should, because you still have new COVID variants, and since people are getting COVID and getting hospitalized at increased rates, it appears to me that they would be subject to the new variants as well. Although I must add that we are still learning about long COVID, and time will tell in terms of what is actually the right thing to do. It's clear for the immunocompromised patient that that they need to get the vaccines. The only question is how effective will these vaccines be for the immunocompromised patient? But there's no question that they should get the vaccines. Now, a lot of people are still asking questions about what are the studies on the new vaccines, and how do we know that they're going to be as good as the other vaccines? And some of the data has not been released, and there's still people coming down with some elements of long COVID and also elements of what they think are related to vaccines. And so we don't know all there is to know about long COVID. And so therefore, the recommendations are varied, but to me, it's clear that they are eligible to get the new variants as well as anybody else. So, one of the things that is also true is that we've only had this issue since 2020. And so I don't know all there is to know about the long-term impact of these infections. And of course, the newest of these is RSV. Yes, John Buchanan.
Is there a percentage of all the people that actually got the long COVID as compared to the regular COVID?
I don't know the answer to that question, John, and I think that's something that I'll try to get for the next time, but I don't know the answer to it now, because that's an important question.
It seems like there are it's kind of fantastic, newsworthy, the long COVID. And a lot of people are afraid of COVID because of the idea of long COVID not having your taste and smell for 6 months, 8 months, a year. There's some people who got it and still have it.
Right. And it looks like that is far less than 20% of people who have gotten long COVID. But that's a significant number.
Dr. Callender, do they treat long COVID with these vaccines?
Now, remember, the vaccine is to prevent.
Right.
Prevent, not treat. And so the treatment for the illness would be different from the vaccine.
Like it.
I think Paxlovid would work with long COVID.
Say again?
Paxlovid.
Yeah.
The treatment.
That's treatment as well. And there's another monoclonal antibody that they have that treats it as well. Yeah.
From the National Institute of Health, it says, as of April, the federal government's Household Pulse Survey estimates that about 10% of adults infected with the virus continue to experience and suffer from the many symptoms termed together as long COVID. So 10% of COVID cases are long COVID.
Thanks.
Thank you. Okay, let's go to the next one. Now this is makes you almost want to cry. see that people who have menopausal symptoms don't take advantage of treatment. It's interesting to see people who have menopause and because of lack of education, they are concerned about getting estrogen treatment that may cause cancer. And so, as a consequence, many of them will just refuse, although vaginal creams are unlikely to give you the cancer that you get from the systemic estrogen treatment. But still, many people, because of this, they don't get any treatment at all. And this is something that is a concern. There's and a lot of it is related to the fact that we know that hormone replacement therapy does have side effects and complications. But that's mostly for this systemic therapy. And there's been many studies that have demonstrated that there are side effects to hormonal replacement therapy. And as a consequence, some women just refuse to have any treatment for the menopause symptoms at all. And a lot of people don't recognize that there are vaginal side effects of the menopause that require only vaginal creams to help that. And
you can also get yourself a nice size fan.
Say again?
You can also get yourself a nice size fan.
Yeah, well, you see a lot of them. You see a lot of them, yeah, especially in
I
church.
changed my whole wardrobe. I just wear short sleeves, and I do carry fans, and I have fans all around my house. In any house that I frequent, I have fans at those houses.
That's common.
Yeah. I know when I was going through menopause and I had an older doctor and as my primary care doctor. And I don't even know that I was really going to a gynecologist for. Anyway, he would not prescribe estrogen. He said that the woman's body is supposed to produce what is needed, and so he wouldn't prescribe it. And since I'm kind of anti-medicine anyway, I was glad. So I never took estrogen anything.
Yeah. Well, it's interesting.
Oh, you got a lot of back. No, you got a lot of background noise.
Yeah. So, well, how many of you have thought about taking estrogen, or has anybody on this ever taken estrogen?
No.
No. No.
And is that related to the fact that estrogen is thought to be related to increased cancer and heart attack things? Yeah. Okay.
Yes.
Okay.
Yes.
Okay, it makes sense. Makes sense.
That might have been his reasoning, but he didn't mention cancer. He just said he didn't prescribe it.
But that was his reason there.
Probably.
Cardiovascular disease as well as cancer. But I think in this article, they're talking a lot about the vaginal creams that may do away with some of the vaginal symptoms, whereas you're talking about systemic symptoms, which would require hormonal replacement treatment. And there are studies which seem to link arteriosclerosis, and cancer. Okay, let's go to the next one. We've talked a lot and had many articles that show how sleep protects brain function by detoxifying and eliminating toxins from the brain by sleep. And this study looks at another way in which the only problem with the study is that a lot of that related to mice. And so the question is, does a lot of this also relate to humans? And so the genetic studies in humans found that this pleiotrophin drug is what is thought to be a problem. And so this is a mechanism by which the sleep helps by decreasing the amount of this compound. And I guess all it says again is that sleep is one of the important factors of contributing to longevity. And one of the ways it does so is by allowing the brain to be detoxified. And this is just one of the compounds that they found. And they found that it accumulates in sleep deprivation. And then people who sleep normal hours, it goes down. And so this then is another reason why we should get 6 to 8 hours of sleep a night. We still have a cohort of people who never get 6 hours of sleep a night, and they feel fine. So, but anyway, that's still the recommendation. Any comments or thoughts about the role that insomnia and not getting 6 to 8 hours of sleep a night affects the brain and affects longevity? It's interesting. I saw this guy was 113. We talked about how he had no he had poor nutrition and did nothing to live to be 113, but he's 113 years old anyway. So there are people who live to long ages who do everything right, and there are people who live to long ages who do nothing right. So
That's right.
interesting. Yeah. But how many people live to be 113? Not many. So
Yeah.
Janice, you had something to say? No? Nobody has anything to say. Okay.
I wanted to ask, this study doesn't say anything, the one before this article didn't say anything about REM sleep.
Oh, yeah. Well, you remember we talked about that before, and I'm not so sure that we know as much as we need to know about REM sleep and whether that REM sleep is really all it's hyped up to be. But you're right, this article doesn't say anything about it. And the articles before that we had talked about REM sleep didn't really demonstrate that REM sleep was so important, although we have a lot of suggestions that REM sleep is desirable. But you're right, this article doesn't talk about REM sleep.
I must not have been on. What is REM sleep?
Oh, that's where you have dreams. That's where you have rapid eye movement, and it's thought to be associated with dreams, and it's thought to be good for you. It shows that you're really dealing when you sleep and you're having dreams. That's a rapid eye motion, as you said, what it stands for. And it's thought to be correlated with good sleep. But if you look at the percentages, it's most of the sleep is not REM sleep. So the question is it overrated or not? I don't know the answer to that.
So to sleep and have dreams, I know someone almost every night, that person the next morning, girl, let me tell you what my dream was about last night. We have dreams all the time. So is that a healthy thing? Some people don't dream at all or seldom dream. But this person, unless they're lying, they always got a big dream.
Yeah, some people do have that gift of having dreams,
Yeah.
But I think most of us don't dream all the time. We dream occasionally.
I dream all the time.
Yeah, and it varies from person to person. How many of you dream all the time?
I dream all the time.
I do.
I do, I don't remember.
Is that an indication of being healthier? Or are these people, another question, these people that dream all the time, do you normally dream longer than the 6 hours that we just talked about?
Most people who have the dreams, they don't know how long they dream. And they do objective tests to determine whether or not you have rapid eye movements. And so, but even when they do that, the percentage of people who have dreams and have rapid eye movement is probably about 20% or less.
Yes, I didn't mean that they dream for 6 hours. Do they sleep longer periods? I don't sleep long anymore. If I get 5 hours, I tell myself that's a good night. But then again, I don't dream either. So are the dreamers people that sleep longer periods during the night? Possibly.
Hey, no.
Well, you know how many hours you sleep at night, and some people sleep a full 8 hours, and some people need 10 hours. Some need less. I sleep less, but it's rare that I have a dream. I was just wondering if there's a correlation between those people that dream. Are they the ones that sleep longer during the night?
I don't know the answer to that question. And I don't know.
Well, I'm asking those who raised their hand and said they dream frequently, and if they sleep longer during the night. Some people have shorter periods of sleep, and some sleep longer. They get that 8 hours of sleep.
Okay, REM sleep is not associated with the length of time that you sleep, because you usually get about 3 to 5 REM cycles per night, but the first one occurs about 90 minutes after falling asleep. So, that's just an hour and a half. Most people are going to get far more than an hour and a half of sleep. So, with those 3 to 5 REM cycles, during each cycle, you could get more than one dream. Because generally, every time you turn over or your body moves, that'll stop one dream. And if you're in a REM cycle, then you enter into another dream. So no, that would not be associated. People that are more prone to remember their dreams, and you can't make the assumption that just because you don't remember your dreams that you don't have dreams. The only way to say if you do a sleep study and they notice REM sleep, then you're in a dream whether you remember it or not.
Dr. Callender, how do they determine REM sleep? How do they measure your rapid eye movement?
I don't know how they measure it, but they do have a way of measuring while you're asleep. I'm not sure how they do it. Any other comment about that? I think whether you dream or not, I think the expectation is that you need at least 6 hours of sleep every night. That's the minimum. And there have been many studies that demonstrate that less than 6 hours a night is not associated with the brain being able to detoxify itself.
Yeah, I heard you say 6 hours of sleep a night. Does it have to be at night?
No,
Okay, as long as it's 6 hours during a 24-hour period.
right.
Okay, thank you.
Yeah, well, if you want the target of adequate sleep to 6 to 8 hours, 8 to 9 is probably a sweet spot for a lot of people. It's just that you have to put the components such as exercise, diet, and stress avoidance. You put those together, and you'll get adequate sleep generally if you're not sick.
Hmm.
Any other questions? If not, we'll move on. It's interesting that many of us have body temperatures at 98.6, but I know I'm lower, and I know a number of people are lower. But one thing is that even though 98.6 is considered the normal, certainly if you're higher than 100 or lower than 96, you're probably going to have issues. And but it's still something that we still in medicine we still say that 98.6 is the normal temperature. But if you're at 99 or if you're 97, it's the only difference is you may react to the environmental temperature a little differently if your temperature is less than 97 and 37 and 97, and if your temperature is higher than 99.
Rh negative blood types typically have lower body temperature, uh, as down to even 95, but 96 is very common for Rh negative. My wife is Rh negative, and she stays at either high 95 or 96.
Does she respond to the environmental temperature any different than you?
Yeah, she does. And I should know the difference, but I've only been married for a month now, so I haven't captured all the nuances between us. I'm more concerned. I'm more concerned with whether I'm comfortable in bed. But okay, yeah, okay, I got this one. At night, she puts the comforter on her side of the bed, and I kick it off of mine. So I sleep warmer with my higher body temperature, and so she's cold, and she likes more cover. Okay, that's it.
Yeah, that's it. Yeah, yeah, I fall into that category as well. Yeah, low body temperature. Yeah. Okay, it doesn't seem as though that there's any pathology identified with it, but it's interesting that the temperature in women tend to be higher than in men, but the temperature declined with age as well. So as we age, our body temperature decreases. Okay, do we have any more?
Yeah, we got a couple more. Yeah, Doc, I noticed that, when I go get my temperature check, I went to NIH yesterday to donate. It's my 107th blood donation. And my temperature was 96 something.
Yeah.
And it's usually low. I can't remember when it was 98. Always noticed it's been low like that.
Yeah. Interesting. Okay, let's go to the next one.
Dr. Callender, while we
Yes.
go to the next one, I think I saw something where it says when you yarn, you are regulating the temperature of your brain, and that your brain temperature is lower than your body temperature. In other words, your brain temperature is around 86 average.
Okay. All right.
Heard
I'm
anything
not,
like that?
no, I'm not familiar with any of that information. No. Okay, this is Jimmy Buffett. I don't know any people who know his music, but he died of Merkel cell cancer but it's rarer than melanoma, and this is skin cancer that is commoner among whiter skinned people, and it's thought to be related to the sun again, as most of skin cancer is, and also it's also associated with a virus. So, but anyway, I don't know. Are there any Jimmy Buffett fans out there?
I
Well,
know his music.
Yeah.
I'm not a
no.
parrot head though.
Yeah, he was a good writer. Also, he liked the Maryland area. Liked to go boating and fishing, and whenever he was in the area, he would book a gig in Baltimore or this area so he could go fishing and get crabs.
So
Like,
you knew a lot about him, huh?
just a little bit. It came out, after his death, but it is an issue that sailors and divers and swimmers, or especially sailors, fishermen, have a higher incidence of skin cancer because
Yeah.
not just the direct sun, the radiation from the sun, but also the reflected sun off the ocean, off the sea. So,
Okay, you know that song Margaritaville? I never heard.
Yeah, yeah.
Mhm.
It's 5 o'clock somewhere.
Yeah.
Okay. All right, let's go to the next one. This that I thought was shocking. That U.S. hospitals paid $100 million to Russian ransomware hackers. That's wow. There are 300 organizations in the U.S., including hospitals, but to think that they spent an average of nearly $11 million cyber attack. Wow. And it's amazing how they traced a lot of them to Russia. It's amazing. And so many hospitals have been targeted. I know Hospital Center, Howard, George Washington. I mean, so it's amazing. Yeah. And it's also amazing how many of these criminals are still at large. Individual hackers, though, you don't hear that much of, although they hit big companies because they have big money. But they also hit small targets as well, but we don't hear that much about it.
Why would they pay, doctor?
Because
Rather-
they have their information and they won't release it. And so in order to get the information, that's why they pay.
So if they don't pay, what do they do? Destroy the information?
Yes,
Okay.
that's a
Or
lot of
shut down the
money.
hospital's
I know,
computer
but you know
system.
what? To me, that means they need to still keep the old way and the new way. Keep files in a file and keep them on, they used to have files.
They still do.
Now everything is electronic, and if they destroy the electronic, you don't have anything.
Yeah.
That's crazy. And they after me for $25 that I paid. But I can't prove that I paid 6 years ago.
Mary Ellen, are you familiar with microfiche? That's the way they used to do it back in the day. They might still do it, but it's a storage method. You store, millions of words of information on a little thin film.
Mm-hmm.
Yeah.
I
Is
I
that
was Mary Ellen. The old way.
They ought to do it both
Anybody
ways.
familiar with file cabinets?
Right.
I got loads of file cabinets in my house.
Yeah, me too.
Loads of information. I remember one time I was getting ready to refinance my house, and they kept telling me that I didn't have the information from one of the people that I had financed through. And I went to my file of all of my records since I had ever had a bank account. And I looked through them and I came up with the name, and it went right through. So there's nothing wrong with files.
That's what I said.
Files.
Okay.
other thing is, I thought technology was, I know they're trying to do the concern about the carbon